Now, as France sees a decline in new COVID-19 cases, this week the country has entered its second phase of easing lockdown regulations after 2 months of a nationwide lockdown due to the pandemic. But bars, restaurants and schools have now reopened there, and in some areas even campsites and holiday accommodation. France is also in favour of reopening the internal borders of the European Union. So have France's measures impacted its coronavirus trajectory? And as we, as South Africa, begin easing our own restrictions, what lessons can we learn? We're joined now by the French ambassador to South Africa, Aurélien Lechevallier, via our Skype line there. Ambassador, thanks very much for your time this morning on the AM report. We understand, in fact, as of Tuesday this week, that your country has decided that bars and restaurants will reopen, campsites and holiday accommodation as well. A risky decision, perhaps?
Well, first of all, good morning, Michelle, and thank you very much for having me. It's always a difficult decision. You know, it's not easy to strike the right balance between the health emergency, between the social consequences, and between the economic impact. Last year, the French economy was doing pretty well. We had a good growth, we had good investments, we were the first European country in terms of attracting foreign investments. So the trajectory was very positive, actually, and we were hit very hard by the COVID-19. It was quite a big shock. And we decided, like in South Africa, to take very strong measures, very harsh measures, and then to have a 2-month lockdown. But at a certain moment, we thought, the French president, the French government thought that it was time to ease a little bit, step by step, with a very cautious approach, the society, the economy, and that's where we are right now.
And I suppose the most important thing, no matter the measures you take to ease the lockdown, is that the people in your country still adhere to those very important preventative measures with COVID-19, wearing your mask at all times when you're outdoors, washing your hands all the time, and hand sanitizer.
No, yeah, that's very true. And also it has to be a reverse process. So if we see that the figures of the epidemic are going bad again, then we could decide to go back to the previous lockdown measures. But so far, what we've seen is that people are respectful. Like in South Africa, there is a good discipline overall. And now we have to respect, of course, all these health measures everywhere. In the companies, in the public transportations, at the terraces of the cafes, for example, at the restaurants. You have to respect the social distancing, and at school. School is of course, also a very difficult debate, but we are trying to create the conditions to welcome back the children at school.
So, Ambassador, you're based here in South Africa, you're in Pretoria, and you're well versed with the challenges that we face as a country in South Africa, and the lockdown, as we know, cannot continue on, let's say, level 5. The economy needs to start opening up. There are discussions now that schools need to reopen as well. Children need to go back to school. Just from what you've learned from living in our country, what do you reckon we can learn here from how France has decided to start slowly and in a phased approach opening up its economy?
Well, first, I think what we learn in this crisis is to be humble. Because there is a lot that we don't know about the COVID-19. Then I think that we have to take measures and policies that are science-based. And I think that the South African president and the South African governments have done well to base their policies, their plan with the different levels, with a scientific approach, engaging with the scientific community. So that is very important. Of course, what you said regarding the health measures, to respect them is also key. And something we learned, I think, is that the COVID-19 is a global challenge, is an international challenge. So it deserves a collective response. It deserves an international response. And that's why our two presidents, President Ramaphosa and President Macron, have been talking. They've been working together because South Africa is also the chair of the African Union, and we've been trying to build a common response with Africa and Europe to make sure that in terms of scientific networks, in terms of response, in terms of tests, we will be together in that fight.
Before we let you go, Ambassador, give us a sense of the rate of infection that you've seen over the past 2 months of the hard lockdown in France, how that curve, has been flattened successfully, and perhaps, what stage of the curve you got to when you decided that this phased reopening of the economy would start to happen?
Well, in France, I think the lockdown was very useful because it is said that without the lockdown, the figures would have been even worse. And unfortunately, we have to cry 30,000 victims in France. So it is a very significant numbers. But it would have been worse without the lockdown. Now, what we see is that maybe the peak of the epidemic is behind us. So we think it's a good moment, certainly, to start to ease and open up the economy. But in that regard, I would say that the situation in South Africa is a bit different because you decided to have the lockdown very early on. And I think that was a smart approach because you could take advantage of that period of the lockdown to strengthen the capacities of the hospitals, of the medical centers. And now I hope that you are also ready to ease and to start with level 3, maybe level 2. But we have to be very clear with one thing. What is key now is the testing policy, the tracking and the screening policy to make sure that you follow all the different clusters of the virus is key in terms of successes against the COVID-19.
Absolutely. Well, thanks very much for your time here on Newzroom Africa. That's Aurélien Lechevallier. He is the French ambassador to South Africa. Always a good thing to get some international perspective on coronavirus, which of course is affecting us as a global community.